Childhood trauma can leave a lasting impression on our lives, often in ways we don't fully comprehend until much later. You see, no one leaves this world unscathed. Life's hardships can follow us to the very end, impacting our physical and mental well-being. Researchers from the University of California, San Francisco, and the University of Michigan have discovered something eye-opening. Traumatic experiences such as parental abuse or even the seemingly less severe event of repeating a school year can amplify pain, depression, and loneliness in our later years. Dr. 𝗦𝗧𝗨𝗗𝗬 of UCSF Division of Geriatrics in the San Francisco VA Medical Center explains that early life trauma, especially parental physical abuse, strongly correlates with end-of-life pain and depressive symptoms. According to 𝗦𝗧𝗨𝗗𝗬, these traumas ripple through a person's lifespan, contributing to social and emotional isolation, poor health habits, and an increased risk of further trauma. This conclusion comes from the Health and Retirement Study, which monitored about 6,500 Americans over the age of 50 from 2006 to 2020. The study included exhaustive questionnaires and final exit interviews with a close family member or friend. Dr. 𝗦𝗧𝗨𝗗𝗬 of the University of Michigan explains that trauma effectively gets under the skin. It's linked with depression and anxiety, fostering a pro-inflammatory environment that can lead to chronic conditions. Interestingly, certain traumas were more common than others, with 2 in 5 participants reporting childhood traumas. Repeating a school year was noted as the most common potentially traumatic event. The study revealed stark figures. Those who hadn't experienced trauma were less likely to suffer from pain or loneliness in their final days. But for those who had endured 5 or more traumatic events, both pain and loneliness were dramatically heightened. Depression, too, showed a significant increase among those with a history of trauma. Dr. 𝗦𝗧𝗨𝗗𝗬 sees these findings as a wake-up call for healthcare providers. Near the end of their lives, people may experience total pain, a mix of spiritual, psychological, and physical pain. Trauma throughout life may shape this total experience of pain. In such cases, seeking help from a psychologist, chaplain, or social worker can be very effective. It's not just about treating symptoms, but addressing the underlying causes of suffering. Chelsea K. Brown, a former social worker with UCSF Division of Palliative Medicine, adds that for someone who has experienced trauma, the loss of control that often accompanies disease can be a painful reminder of past harmful experiences. This study underscores the need for more research on the links between early life trauma and end-of-life experiences. Future studies should consider different cultures and socio-economic backgrounds to understand how environments affect trauma. In conclusion, trauma isn't a blank slate. It marks us, shapes us, and affects us even in our final years. The memories we carry are not just mental constructs. They have real physiological impacts. As we strive to understand trauma's effects better, we must remember to treat the whole individual, not just the disease. It's a crucial step towards intentional, compassionate, and holistic care. Thank you for watching 𝗦𝗧𝗨𝗗𝗬.